Have you ever thought if you or a loved one or somebody that you knew that you were friends with ever went into the hospital because they were really sick or for whatever reason and they ever became restrained? I'm going to talk today about restraints in the hospital setting. The purpose of this is to inform all of you about the rights of patients when they are restrained, and also just to give you some information to know about what restraints are and what their purpose is and why they're used and who can order them and all of that good stuff. So first, let's talk about the different kinds of restraints. There are leather restraints, which are under the category of physical restraints. So there's leather restraints, there's soft restraints, there's mitts, and that's usually the ones that are used most. Then there's also the chemical restraint, which is medication. And sometimes you need those before you want to use a physical restraint because it'll be better for the patient. But we'll get into that in a little bit. Also seclusion. So first let's talk about the physical restraints. I have a picture of the leather restraints. Now these are used for patients that are very combative and very strong, and that could be any age. Really, there's no age to it because even the old grandmas, they can be very strong and you would never guess. Although with these, because their skin and all those other goods and their bones are very brittle, we usually don't use restraints on them. It's for more the younger kids, ones that are trying to hurt themselves or hurt other people. Second are the soft restraints, which look like this. They're just what they say, soft restraints, and they are used in either 2-point or 4-point fashion along with the leather restraints. So it's usually one arm and then the opposite leg and vice versa, or all four if the patient is very combative or is very trying to hurt themselves or trying to get out of the bed or trying to, and they can't get out of the bed. There's so many reasons why restraints are used. And then another one are the mitts. Now the mitts just look like big gloves, which is what they are. They're very comfortable. And the mitts are used if, a patient is trying to pull out an IV line, which is very necessary. So all of these restraints, they all have a purpose. And the purpose is to basically stop the patient from harming themselves, from harming others, and from harming the staff. Being that I have been in the hospital setting for around 6 years, I'm very in tune with all of these restraints and what they're used for. They use them a lot, and I think it's a good thing that they use them, because it stops the patient from harming themselves, because just pulling out an IV is harmful because, God forbid, something happens to that patient. If it's your mom, your dad, your grandma, your grandpa, your brother, your sister, they need that IV in order to get their medications, or if something happens, then the doctor needs to give them medications right away. That's how they access it. It's a lot easier than putting it through your skin and stuff like that. So the next is really the doctor is who orders the restraints. The doctor has the final say so, and but the nurse is like kind of the pathway to that. She kind of makes the decisions because she's with the patient all the time and they know whether it's right or wrong. I know many hospitals, they try to be a restraint-free environment, which means that they try to do everything they can leading up until the restraints, because you can get pressure ulcers from restraints. You can, you can break a bone if the patient is that frail, because if they're struggling, they can hurt themselves very badly. Also, with the chemical restraints, now we're on to the chemical restraints. They are the most common drugs that I know about are Ativan and Haldol, which are both just to relax the patient and calm the patient down to get them to a relaxed level and sometimes even sleep. It's the best situation for the patient most of the time, because they don't do much if they're sleeping. And that way whomever can do what they need to do with the patient, and they're not trying to get out of bed, because if a patient is a fall risk and they fall and hurt themselves, well, that's just a longer time in the hospital. So with all of those things, of course, come the legalities. And with patient rights, you are allowed to be treated with the utmost respect. Restraints, whether they're chemical or physical, or being secluded in another room if you're screaming or yelling, they are not supposed to be for your, harmful. Okay, so by me saying that, meaning if you're not supposed to be disciplined and being put in restraints, or if the staff member gets upset with you because they're tired and they're having a long day and you're just getting on their nerves, and they think that the best thing to do is to put you in restraints. Well, it's not. They're not for that purpose. They're for the safety of the patient, the staff, and other people. You have the utmost rights as anybody else, but they are for the safety of yourself. Thank you.